It's a problem that is all too common. Children can have 20/20 vision and still have a problem with their eyes that keeps them from reading. It's called Convergence Insufficiency, or CI. Kids who have convergence insufficiency may be misdiagnosed with ADD or other learning disabilities.
Okay, convergence insufficiency is a problem with the alignment of the eye muscles. The muscles in the eyes don't quite line up just right. And so trying to read, people are trying to correct for that little drift that's in their eye muscles. And that drift causes eye strain, headaches. Some people have problems with attention. Some people can't see 3D. Some people read things over and lose their place. So it's kind of causing ADD type symptoms. Well, many children have problems reading and concentrating. Reading comprehension is one thing that's often noticed. Many children get headaches, and it can really stifle their learning, development. First of all, I test the children for it, and we go through a little battery of depth perception and binocular vision tests. And if we can confirm that the children have the convergence insufficiency, we can incorporate into a pair of reading glasses a special feature called a prism. And a prism is an extra lens that helps the eye muscles to pull together more efficiently. And that extra lack of strain causes people to read more easily. They don't strain, they don't get headaches, they don't have the ADD type symptoms, and their ability to concentrate goes up. We're not really sure what causes convergence insufficiency. It seems to be an anatomical misalignment from the eye muscles, that the muscles that control focusing and the eye muscles that control the movement of the eye muscle just aren't teamed up exactly right. So something's off. Most people don't have a problem in the distance, although there are some. But when people get to closer up tasks, it shows that the binocular vision system isn't tuned up properly. And it causes a little bit more of a strain, a pulling, a tiredness. And it just basically leads to problems when we stare at things close up.
This is the track the dot takes in a child with convergence insufficiency. The eyes are not able to focus together on the same spot, and because it starts during infancy, a child will not know there is something wrong with the way he is seeing things. To a child or an adult with convergence insufficiency, they may feel sleepy when they read, or this page may look like having double vision.
First of all, the best thing they should do is see their eye care professional. They should see an optometrist who hopefully specializes in depth perception and binocular vision problems. They should ask questions as though I'm having problems with eye strain, headaches, I feel as though I can't concentrate, and ask them specifically, do you test for convergence insufficiency? Do you test binocular vision? Do you test depth perception? Well, these tests are very simple. I can do the battery of tests in 5 minutes on each patient, and each patient's results are quite different. It just takes a little extra time to do the extra tests that not often included in a normal routine eye exam. It's probably 80-something% successful once the people know that they have the problem, and once they're told of the solution for the problem, and they try the reading glasses, they're noticing, wow, this is much easier to read. I can read more comfortably. I don't strain. I'm not having problems. Rarely someone will say that their glasses didn't do anything for them, or people will say almost always that their glasses made some difference if they used them.
Some children are diagnosed with ADD or other disorders when there was nothing obvious to suggest the problem was with the eyes. That's because a regular vision exam will not pick up CI. You need specialized screening like this.
I'd like for you to look at my pen, please. Stare at my pen. So you see his eyes moving a little bit. They're correcting. See, he's correcting. A little movement there. See it with the pen. This is called a cover test. We cover his eye and see how his depth perception is. Another test is a stereo slide. Can you please tell me that picture there?
A butterfly.
Very good. That is very good. And this test shows to see his eyes work together to show that he has depth perception or stereo vision. Please follow my pen wherever it goes. Very good. Thank you. The problem is that we're staring at the computer for longer periods of time. People, when they read a book, they often read for a while and they look up. Or if they're working on a paper, they'll look up, look around, and go back to reading. But something about working on a computer keeps people engrossed in what they're doing, and they just keep getting into it more. So they stare longer, they stare more intently, and they don't tend to look around as often. So they cause this problem, computer vision syndrome, where people just need to take more breaks and look away. Kids playing video games and things like that, they tend to really get into their game, and they don't often take the break. So some people are instructed to every 20 minutes look away for 20 seconds. They call it the 20-20 rule. So something, since the computers have become real popular and mainstream, people so engrossed in that don't take the break. That lack of break builds up the eye strain, which causes the problems, the migraines, and the convergence insufficiency and attention problems. Occasionally I'll find people that have alignment problems in the distance. They're not focusing right, or they're finding that they're getting more headaches and eye strain just any time in their life, not only just when they read. But specifically, it's more, since the computer age really kicked in, a lot more eye strain. It's becoming epidemic, actually. There's so much computer strain. Mm-hmm. When I graduated in the late 70s, it was something I would see rarely, and now it's every other patient probably.
Sensory learning therapy and special glasses can help retrain the eyes of kids and adults with convergence insufficiency to work together. With the right diagnosis, kids and adults can have specialized therapy and be reading in no time.
Basically, I would say to see their eye care professional, get a thorough eye exam, testing their vision, their depth perception, their eye muscles. They should take breaks when they read, every 20 minutes, look away, get away from the computers and get away from the video games occasionally and look around. And be attentive to eye symptoms, things like headaches if they've been undiagnosed, or if their doctor can't find any actual cause for the headaches. Look into the vision system as a possible cause of headaches. It's often overlooked.
It's estimated that 25% of the children diagnosed with ADD and ADHD may actually have convergence insufficiency. And it's not just kids. Adults should also be checked for convergence insufficiency. For more information on convergence insufficiency, visit Dr. Skovira's website.